Hello, my name is Marisha Chillcott. I'm a physician in Santa Rosa, California. I'm the Chief Medical Officer and founder of Be the Change in Mental Health. What is CAP? Ketamine Assisted Psychotherapy. I want to really put the emphasis there on psychotherapy. You can think of ketamine as acting as a lubricant to the therapy itself. It makes it easier for our brains, minds, hearts, souls to accept or make more change as is indicated by the therapeutic process. Ketamine has biochemical effects on our brains that does change our mood, but that is very temporary. Nonetheless, it makes it so that when we use ketamine as a medication, either as an anesthetic agent or as part of a therapeutic process, the immediate effect is feeling quite a bit better if we've been depressed or anxious. That feeling, unfortunately, does not persist unless you actually make changes in the other external components of what's influencing your life, hence the therapy. Ketamine is a medication that was first synthesized in 1962. Ketamine was FDA approved as an anesthetic agent in 1970. It's been used continuously since then, although less so in more recent years because there are newer medications such as propofol. That said, in the last 2 to 5 years, we have been seeing more use of ketamine in the emergency rooms and on paramedic rigs in order to address pain in an acute situation. Although no element of racemic ketamine, that is the kind that we give IV or IM, is, quote, FDA approved, close quote, for psychotherapeutic use, S-ketamine, which is a version of ketamine, was FDA approved in 2019 for use with major depressive disorder. Thus, although the generic version is not, quote, approved, it is clear that this medication has application and usefulness for the improvement of psychological states. It is an incredibly safe medication. In fact, so safe that it can be used in the field by medics, paramedics, or field medics in the armed services without even having to take blood pressures or check other vital signs before its administration. This is because, unlike opiates and most other anesthetic medicines, it does not cause a drop in blood pressure. In fact, one of the single side effects of ketamine as an anesthetic is that it raises blood pressure. This means that it's very useful in the case where a patient may be in shock. Now, that application goes beyond what we are talking about here today, but I just wanted to give that other overview, that it's very safe. My experience with ketamine initially was when I was an emergency room physician, and I used to use it, along with my other colleagues, as the primary means of anesthetizing small children, particularly toddlers under the age of 4. This would be the case when a small child would come in with a laceration or a broken bone or a dislocated bone, and we needed to give them something quickly, safely, and easily so that they could be made comfortable and we could repair whatever situation was at hand. Because ketamine is administered either intravenously or intramuscularly, it meant that we can give medicines like this without having to start an IV in a small child. You can just give them a little shot in their thigh. I cannot emphasize enough that receiving CAP, ketamine-assisted psychotherapy, is not the same as going to a ketamine clinic and getting ketamine. Getting ketamine at a clinic is only a little better, albeit probably a little safer, than going to the local drug dealer and saying, dude, can I get a hit of Special K? Because the medication is not the same as the process. And it's the process that makes the difference. Let's talk more about CAP, ketamine-assisted psychotherapy. What's the process? Very, very importantly, this is a process that focuses on therapy with someone who can create both a safe environment as well as guide the process of psychological change. Prior to receiving medication, you meet with your therapist or the group and identify what your individual intention is for this process. A typical example might be, I want to address my intense anxiety and get myself to a place where I can enjoy my life and work and family again. Another might be, I want to stop having nightmares about an experience that happened many years ago, or a few weeks ago, or a few months ago. Another possible intention might be, I just want to feel good in my own skin. After an effective preparation session, there's the medication session. The medication session involves receiving medicine. In our office, the medication experience starts with taking 1 or 2 medicines to prevent nausea. Nausea can be a side effect of ketamine. Then one gets comfortable lying on a couch or a bed or a set of cushions. You must cover the eyes with an eye shade and have earphones at the ready. Being in a state where you have earphones of music as well as vision impaired is a very important part of the process because it allows you to turn inward and gives you all the mechanical advantage to do so. The medication is then administered as an intravenous or intramuscular shot. We actually give it intramuscularly at Be the Change in Mental Health. While under the influence of the medication, a patient then can feel anything from a light sense of disconnection to their body. I describe this as, when it's very deep, feeling a deep awareness of your soul and yourself are separate from your body. While in the medication experience, the therapist and/or a guide holds space. I put that in quotes, holds space. What that means is they make sure that there is someone else with close enough physical presence so that the person who's received the medication, even though they've got their eyes covered and their ears experiencing the music, knows that there's someone there who will hold them or take care of them should they need that. There may sometimes be difficult feelings or imagery, and the instructions are to move towards those. Those are things that have something to teach one. Some people experience beautiful scenes of space and of colors or lights. Everyone's experience is different, and everyone's experience is different each time. Following the medication experience, one feels a little bit spacey and should take it easy for the rest of the day, taking care of oneself. No driving or operating heavy machinery for at least 12 hours. The following day, or within the following few days, you have an integration session with the therapist. The therapist then helps you, as I referred to before, lay down new tracks in your snow. You talk not only about what you may have experienced, and you may not talk about the experience itself at all, but actually do a therapeutic process that involves how life is going to be better, or what your changes you're going to make, or what insights you've had that let you see that life can be different and how you are going to be part of that different process. You can think of the ketamine medication as like a blizzard in your brain. It causes a whole snowstorm of things to go on, much of which you don't understand. You really can't see. Sometimes it can be scary. Sometimes it can be beautiful. But afterwards, when one comes out of the ketamine medication state, it's as if life is coated in a beautiful blanket of snow. Then the therapy has to start. And that therapeutic process is like deciding where are you going to make new tracks in the snow. If you don't do therapy, the snow will slowly melt and the old tracks are still down there, the stuff that the snow had covered up. That's why it's so critical to do therapeutic work with a professional therapist trained in assisting people in making changes in their lives and make new tracks and new grooves in the snow. In the setting of CAP, ketamine can be administered 3 ways: intravenously, intramuscularly, and sublingually. The disadvantage of intravenous is that it requires placing an intravenous line, which can be a little bit more cumbersome, a little bit more uncomfortable, and honestly has more potential complications. Sublingual challenges are that the vial availability is far less than either IM or IV. Intramuscular and intravenous applications of the medication have almost a 99% bioavailability and an onset of the effects of the drug in less than several minutes. Also, emergence from the medication is relatively predictable. Sublingual applications, which has the advantage of sounding more palatable, no pun intended, because it tastes terrible, but easier because it doesn't involve a needle, can have the challenges of reduced bioavailability, more like 20 to 30%, and very variable onset of drugs. It also has quite a bit of variability with respect to emergence, as although the sublingual application is a lozenge placed under the tongue, and patients are instructed to spit out as they accumulate saliva in their mouth, some percentage of that ends up getting swallowed. And then once the ketamine is also in the digestive tract, it has an effect with the liver and can take much longer to be metabolized by the system. For perspective, when ketamine is used as an anesthetic medication, it is usually given at a dose of 2 milligrams per kilogram. In contrast, when we use it for psychotherapeutic effects, we use it at a dose of anywhere from 0.25 milligrams per kilogram to 1 to 1.5 milligrams per kilogram. There are some cases where we may use higher doses, such as when someone has extreme tolerance, but those are the typical dose ranges. It's very important to note that following integration and following the medication session, there may be weeks or months of ongoing change, and it is not uncommon for people to realize months later, wow, that was the pivotal moment. Those were the pivotal or significant changes that started me on a new journey. Based on clinical evidence, Be the Change in Mental Health uses a series of 6 treatments where one receives medication and then integration in the setting of individual treatment. If someone is participating in a group therapy session at Be the Change, we sometimes use as few as 2 to 4 sessions with medication. That is because it has been found that group therapy with the support of others who have similar experiences or an ability to compassionately empathize creates a societal and social network that supports an individual even more than an individual therapist with an individual doing personal therapy. And because of that, we often find that the efficacy can be multiplied, and therefore we do not need to do as many sessions. The goal is not to take a lot of medication. The goal is to have a new and better life. You do not need to stop any of your previously prescribed medications for depression or anxiety in order to participate in CAP. Even though you may not have stopped medications to participate in ketamine-assisted psychotherapy, one may find that after one has participated, that you do not need those medications as much. We then strongly recommend that you work with a provider who has originally prescribed those medicines or with one of our therapists or medical providers to gradually wean off of existing medications. Our goal for people is to get all the way better, or at least enough better, to then move on with their lives. We are not looking for patients to stay in a state where they need to use ketamine or ketamine-assisted psychotherapy on a very regular basis. That said, depression and anxiety are chronic recurrent conditions, and life keeps happening. And when life happens and is negative, it is very likely that one may need a tune-up or a repeat series of sessions. That's okay. It's just not something that you do ongoing forever and ever. Mental health, like physical health, is not a static place that you get to. You do not just get healthy and stay healthy without doing things to maintain one's health. So kind of like if you train for a marathon and get really, really fit, and then you run the marathon, afterwards, you have to keep running and keep exercising, or that fitness will fade. Similarly, doing a series of ketamine-assisted psychotherapy treatments will get you to a new place of mental health wellness. But you have to keep doing the work to stay there. And there are times where you may need a tune-up again. Just like if you're working out, you may need to meet with your coach again, even after you've finished and won your race. So, things to think about. After you've done ketamine-assisted psychotherapy, after you've gotten to a new place and made a stair-step improvement in your life, you need to do the things we all know about. You need to, since I'm already talking about it, get regular exercise. You need to eat a healthy, nutritious diet that maintains your well-being. Get outside, see the sunshine, be in nature, breathe clean air. You should also be spending regular amounts of time with friends and family and people who you love and who support you. Even if you're an introvert, you are a human. Humans are social creatures and need social contact. The myth of the hermit being a healthy human is completely untrue. And very importantly, you should avoid alcohol, marijuana, and other depressants. I'm not saying to be a teetotaler, but regular use of medications that depress your brain are going to depress your mood. And as much as people love to think that these things improve things, it's not true. So I'm not saying never, but definitely want to reduce the use. Even after one has gotten to a really healthy state, even when one has become incredibly mentally and emotionally resilient, sometimes the universe hands us really difficult things that we can't expect, things that can knock us off our feet. A loved one could die, our house can burn down, any number of things can happen, and they can cause us to return to a state of depression and anxiety. Now, before we all get hit all the way to rock bottom, one can reach out and have another CAP session that will help us regain our strength, regain our footing. One thing that's important to understand is that being mentally well doesn't mean bad things don't happen. I tell this to patients all the time. I can help you feel better. It's not going to change that you're still getting divorced, but it's going to give you greater fortitude and capacity to deal with the issues that are at hand while you're living your life. Life isn't all joy. The negative valence emotions of frustration, anger, sadness are the balance of the positive valence emotions: joy, humor, amusement, learning, growth. We have to have all of it. We want to tip the scale to be more on the positive valence side, but things that are easy don't feel worthwhile. And therefore, if it was all just fun, we wouldn't actually be happy. Humans are odd that way. So thank you so much for your attention. I hope this has been informative. I hope it has been useful. And if you have further questions or interests, please go to our website, btcmentalhealth.org. Telephone number is below, but 707-800-7568. And we look forward to meeting you. Let us know if you'd like to have a consultation.